So good afternoon, everybody. I'm Sonya Girdler, and as Fiona said, I live in Perth, Western Australia, and it's so wonderful to be with you all today virtually. And I'm director of the Curtin Autism Research Group here in Perth. And as Fiona said, I'm co-presenting this talk with my wonderful colleague, Dr. Wenn Lawson, who's in Victoria on the other side of Australia. And a big shout out to Wenn for staying up till midnight. So thank you, Wenn. I'd also like to acknowledge my colleague, Professor Sven Bolte, who's also contributed to this talk, and he's in Stockholm, Sweden, and he has done much of the work that I'm presenting today. So to begin with a summary, this talk will highlight that our understanding of autism to date has been largely driven by the medical model, and that there is a need for a more balanced perspective, which includes quality of life, functioning, and neurodiversity, and that maybe the ICF Core Sets for autism can serve as a framework for building this more holistic understanding of autism. And when we'll talk about interoception and neurodiversity. So as we all know, according to the medical model, neurodevelopmental disorders such as autism and ADHD are behaviourally defined, adaptive functioning difficulties arising from variations, alterations, and atypical maturation of the human brain. The medical model fails to consider quality of life. It also only makes brief reference to functioning, with the DSM-5 stating that the deficits associated with autism result in functional limitations in effective communication, social participation, social relationships, academic achievement, or occupational performance, individually or in combination. While it's widely argued that NDDs are complex conditions with their presentation and functional impact underpinned by a diverse range of genetic and environmental factors, contemporary and somewhat polarising debate has focused on the appropriateness of the medical model as opposed to the neurodiverse model in framing conceptions of these conditions. While the medical model considers symptoms and diagnosis as paramount, they are really only a place to begin. What people are concerned about is everyday functioning, what they are able to do and achieve in their everyday lives, and their quality of life. But what is quality of life? Quality of life is the degree to which an individual is healthy, comfortable, and able to participate in or enjoy their life events. The term quality of life is inherently ambiguous, as it can refer to both the experience an individual has of his or her own quality of life and the living conditions in which they find themselves. Quality of life is highly subjective. Whereas one person may define quality of life according to wealth or satisfaction with life, another person may define it in terms of capabilities. For example, having the ability to live a good life in terms of emotional and physical well-being. A person living with an impairment or health condition may report a high quality of life, whereas a physically healthy person may report a low quality of life. So what is functioning? Functioning considers abilities and disabilities as a result of a complex interaction between the individual and the environment. Functioning considers both objective and subjective realities. It considers the person in his or her own world. The International Classification of Functioning, Disability and Health, or ICF, is a framework for organising and documenting information on functioning and disability. The ICF takes on a biopsychosocial approach, which indicates that an individual's functioning is the outcome of interactions between the health condition, in this case autism, interacting with body functions and structures, activities and participation, and environment or personal factors. For example, an autistic child's ability to focus in class may be influenced by overstimulation as a result of large class sizes, or they may struggle in a crowded cafeteria. The ICF Core Sets for ASD can be used to identify factors such as these that may contribute to poor functional outcomes for autistic individuals. Over the evolution of our understanding of autism and in developing interventions, there's been a lot of focus on those factors associated with impairments or challenges of autism. There are a few frameworks that present a balanced understanding of functioning that capture both the challenges and strengths of autistic individuals that can be inclusive of a neurodiverse approach. The ICF is a notable exception. The ICF looks at disability holistically. While it considers impairments and participation restrictions, It also considers factors within an individual's environment and personal factors within the individual that can either facilitate or pose a barrier to functioning. But one problem is the ICF has 1,685 codes, making it somewhat unwieldy as a framework for research or understanding the functioning of individuals. But because of an extensive international project led by Sven Bolte at Karolinska Institute for Neurodevelopmental Disorders, or KIND, we now have the ICF Core Sets for ASD. And these core sets have identified those categories most relevant to understanding functioning in autism. These core sets have been an enormous help to researchers such as myself. The ICF Core Sets for ASD highlight those ICF codes most relevant to understanding autism in each of the domains. But the ICF also helps us to reconcile some aspects of the medical model and neurodiverse approaches by taking a holistic view of functioning. The ICF can account for impairments or challenges in the domain of body functions and structures, but also direct our focus to the importance of promoting engagement in major life areas, the importance of active citizenship for autistic individuals, and giving voice to their experiences. The ICF also considers the role of environmental factors, for example, those factors that play a role in the etiology of autism, but also those factors that pose a barrier and a facilitator to everyday functioning, and as a potential target for interventions. It can encompass the social model of disability. But importantly, the ICF also considers personal factors of an individual, including their strengths, embracing human diversity, and highlighting the importance of understanding the individual. The ICF reminds us to consider diversity and the skills and abilities of autistic individuals, including their tendency for a high level of attention to detail, a preference to work on repeated or monotonous tasks, their mathematical abilities, their visual perceptual skills, and their intellectual functions. The ICF can help to frame and understand autism in major life areas such as employment, considering those factors that impact on outcomes in the environment. We have used the ICF Core Sets for ASD to frame many studies in the employment space, from understanding experience of transition to adulthood, to writing a framework for a scoping review, and in shaping a policy brief which was funded by INSAR and is freely available on their website. We've also used the ICF Core Sets to guide our work with autistic teenagers in leveraging their skills and abilities in building pathways to employment in the information communication and technology industry, and looking at interventions which target the environment, such as peer mentoring at university. I'd now like to hand over to my colleague, Wenn Lawson, who is going to present the next part of our presentation. Wenn, do you want to share your screen or you want me to keep sharing mine?
I think yours to save time, Sonya. Thank you.
Okay, all right.
Yeah, so first slide, please.
Here we go.
I also want to say thank you for allowing me to be presenting to folk around wherever they're listening. And I've been very excited as I followed through, for me, my nighttime viewing of listening to people speak. So that's quite exciting. So here we have a picture of kids that were at a holiday program. My granddaughter in the stripy top there is having a very exciting time by laying her bricks blocks one in front of the other. Other children tended to build up. Holly builds along. And for her it was exciting because each piece she put down helped her forward think to the next piece. And it's different, but that's fine. Next slide, please. So elements that come together. Sonya has shared with you about the ICF Core Sets for autism. And I just want to add some practical components to our discussion, especially when it comes to functioning and the Gestalt of Functioning, because quite often in autism, there are elements that are not typically known amongst professionals, researchers, as autistic people ourselves. We often don't talk about these either because we haven't had words for them. So I want to share some of those with you. Next slide, please. So the autistic disposition, and it was lovely to hear Damien talk about the monotropic disposition. That was quite exciting for me. part of being monotropic and single focused, literal, bit black and white at times, is that object permanence, that sense of knowing that objects have a life of their own even when out of view. And it isn't just objects. It might be mummy when the kids are at school. We can't see her anymore. Is she still alive? It might be, yes, I know what's in my lunchbox, but I don't know what's happening in the next classroom. I can't see. Is the sun still shining? I can't see that. It was there, but maybe it's gone now. That sense of object permanence can be delayed or poorly formed in autism. As part of that understanding of Gestalt of Functioning, we need to look at that one too. Next slide, please. How can I relax at school if I don't know home still exists? I need a way to understand object permanence. And with my granddaughter that you saw earlier in the stripy top there, she would often wake up at night because she didn't know if mummy was still there, and so she'd have to come and have a look. So we gave her a walkie-talkie, and mummy had the other end. Still not nicely woken up through the walkie-talkie, but it gave a way through, a door into an understanding for Holly that mummy was still there, even if she couldn't see her. And we practiced that in every room of the house, so that eventually Holly didn't need to wake up because she knew she had that map that was already being built through a practical application. And next slide, please. And interoception, this makes me smile because I love dogs for one thing, but interoception, that sense of knowing what's going on inside you, not externally coming towards you, like seeing and hearing and tasting and those sorts of senses, but what's going on inside lets us feel or connect to things like pain, temperature, hunger, anxiety, desire, need for toileting, other needs, thirst, etc. And also, as part of that monotropic sense, quite often interoception, although it's happening, we're not connecting to it. We've not yet built that ability sometimes cognitively. This is supposed to be established in very young infants, but often it isn't. Sorry, thanks, Sonya. So the ICF Course Sets for Autism could be very useful as long as we understand the fuller picture that they might relate to. So it was lovely that Sonya actually mentioned the one code there that talked about, it's not one code, it's a collaboration of codes that talk about connecting to personal factors, that talk about connecting to that wider understanding of functioning. And if we don't have an understanding of autism, we can have all the codes in the world, but you won't actually be able to know how to apply them. So knowing about object permanence in us as autistic people, knowing about interoception, and knowing that we may not actually feel or be aware of those things, we can then use something like the ICF Core Sets for Autism to help uncover some of those things and work together with autistic people, because it should always be nothing about me without me, with autistic people to put that bigger picture together to help them build those sorts of understandings. When I was a student in, it's called Bradford in Yorkshire, I think, in the UK. I was sent from Australia to, sounds like I was posted, I don't mean that, but I went on a sort of a student exchange. That's it. So I was doing some work over there way back in the late 90s, and I knew Australia existed. I could look it up in a book of maps, but I didn't know it existed. I didn't have the sense of it being there, and I kept being quite fearful that maybe my family no longer exist either. Seeing that shape on a page didn't give me that kind of understanding. So a friend from the autistic group in autistic support group in Bradford said, "Do you have a photo?" I thought, well, yes, I think I do. Anyway, I found the photo, and she said, "Carry that in your wallet, and you can look at it frequently to remind yourself that they are still here." And I found that, I know it's a small thing, but I found that really helpful. But no one would know that by looking at a list of codes. They wouldn't know how to apply them if they didn't know that sort of thing is what's going on for those of us who are autistic. Thanks, Sonya. So I was lovely listening to Judy earlier, sent her a text and said she did real well. Diversity is a property of populations and not individuals. We are all in, and I can't read the next bit because my picture's covering it, but it doesn't matter. Judy covered that really well. Neurodiversity, being neurodivergent, part of being human, and knowing where you fit and knowing how that comes together is really important. Next slide, please. So to diverge from, you've got to know what you're moving away from, and you've got to know what you're moving towards. The ICF Core Sets for Autism can help with that Gestalt of Functioning if autism is fully understood. And we need to listen to autistics. Far too long, we read the textbooks and we listen to other professionals, but we don't listen to us as autistic people. So again, it was lovely listening to Damien. Lots of very good fond memories of being together over the years, but it was lovely listening to him and the way he so fully explained it. Beautifully put. Double empathy problem, absolutely. Thanks, Sonya. Brilliant. Thank you very, very much. I really appreciated that. And there might be a question or something. I don't know how that was supposed to work.
Fiona, are there any questions or?
Mute. I'm trying to unmute quickly on time. We actually don't have questions organized, okay. But I guess if we don't, I might just ask you one or two questions myself. I'm turning off my phone because I'm guilty of going and getting a cup of tea and I put it on phone. Okay, so now my phone is off as well. Yeah. I wasn't familiar with the ICF, and so that's something new for me. And I was kind of thinking why, and of course, as you say, the DSM, the ICD, they're very much, sorry, start my video. There we are. They're very much disease focused and they're looking at impairment. And all of this morning has been so interesting because, you know, appreciating diversity and difference, but actually for me, it's spinning it around completely and looking at the strengths. And I was thinking that maybe it's because as a clinician, we run services and the services are bound by, if you need our help, you come to us. The resource constraint as well. So you do need an impairment in order for us to be offering an intervention. Sometimes it's a biological intervention, other times it's cognitive, supports, environmental, educational. But the downside of that for me, as I was thinking through it, is, you know, people, as you say, they may come with the core skills or areas on the autistic spectrum, but they may be coming for ADHD management, or they may be coming for depression management, where there is a recognized impairment and they recognize it's not helping them and they want support with it. But by not focusing on the ICF, we're losing on all of that strength components that are within, you know, different, I won't call them disorders now, but different named categories, be it ADHD or be it autism. You know, that the differences actually do bring all of that. And I'd love to hear a little bit more about how you found the ICF, whether you're finding that it should be more incorporated into clinical services, educational services.
Go, Sonya.
Want me to go? Yeah, so I'll start. I just think the ICF is a wonderful document. It's my favorite thing. It stays on my desk, you know, it doesn't leave. I'm an occupational therapist by background, and I guess that's my biggest disclaimer is I was taught the ICF from year 1 of university, and it was published in 2000, so it's been around a long time. I really value the ICF because it gives us a holistic view of functioning. It does consider those impairment-related factors that are in the DSM and that kind of thing, but it reminds us not to forget about the environment, not to forget about the individual, to look at barriers and facilitators, that very holistic view of functioning and how we understand ability and disability. And that to me is its enormous strength. And when we started probably a decade ago using the ICF, I used to make my students link their work to the entire ICF, so all 1,685 codes. So my PhD students are very grateful to Sven's work, which actually has brought it down to 111 codes in the comprehensive set. So that's been so wonderful for my group, is actually having a more tidy group of codes to consider. But it's very much guided our philosophy and our approach to our work. So here in Australia, we've been running computer coding clubs for autistic teenagers. We have, 300 autistic teenagers doing coding clubs on the weekends. We run strengths-based maths groups. So while we have clinical services, my research group is very much focused on community-based interventions and that community level. So I'm not so involved in running clinics and that kind of thing, but actually more that community intervention level is what most of my work's focused on. And that's where the ICF has been incredibly useful. That being said, we are turning the ICF into a clinical assessment as well. So I have a couple of PhD students working on developing a clinical assessment to be used in clinics, and we should have that work finished in the next year or so. So we are working on that with Sven Bolte. He's also working on a functional assessment, and we're working on that work together. So it's very exciting.
And the other thing, of course, is that the language that's changing around autism. So even terms like intervention, somebody stepping into my life to take over, no thank you. But when I'm reaching out for support and I'm asking for help, just like I need my glasses and my cap to keep off the light and whatever else that I'm needing, that should be available. And that's the joy, one of the joys of the ICF, is that it's providing a framework to address a whole heap of issues that people haven't even recognized in the past. And it's biopsychosexual, no, not really. Biopsycho, help me out, Sonya.
Biopsychosocial.
That's it, yeah. It's a long word.
Late there, Wenn.
It's too late at night. So yeah, good. We better leave sex out for this time of the night, I think. So yeah, looking at the whole person and avoiding language that is deficit based. And neurodiversity, I mean, this says everything we've been hearing tonight. I mean, today. All right, thank you.
And when maybe just before you go to bed or before your brain really gets too tired, just one last question. In those that are considered neurotypical, but nonetheless have significant empathy problems, and you know there are many in that category, have you any advice about how you can help them with those challenges and to be mindful of them, to be aware, cognizant of them? And
I think it's exactly, yeah, as you have said, we just need to be mindful. We need to be building bridges between one another, talking, having a conversation, an ongoing discussion, just like what's happening here, so that we listen to one another. Because even when I think of ASD, and we don't use that terminology very much now, but that's still autism spectrum ability or difference of ability. And when Simon talked about the 4 Ds, and I've heard Rita Jordan talk in a similar way, that it's about, yeah, difference can lead to disorder, disease and so on when it is not accommodated for. So it's learning to respect, to share and build that equality between us, to remove stigma. And lots of people are writing, Rachel writes about that, other people write about it, Rachel Wood, and I might even have her name wrong, forgive me. But yeah, we're getting there. We've just got to keep dripping away at it.
Yeah. And I guess that's what's so exciting for me in UCD, to be hearing about this today. I know Fiona and the working group, the neurodiversity working group, you know, they've been in this space for the last year. It really is, we're hoping that UCD will be just that, where that difference does not lead to disability, disease, disorder. But when the difference contributes to difficulties, just navigating a system, in the same way when you're new to a town, you don't know where the local shops are or the way to go, that there are those signposts, there are those maps, there is that understanding. And what we're hearing today is both talking about it is helpful. People who've gone there before and have developed manuals, resources, you know, a lot of the work is being done, and it's sharing it, you know, making sure that, you know, we're all doing it, and I guess learning by mistakes that are being made along the way as well. Yeah. Well, guys, unless you have anything else that you wanted to add, it was a wonderful presentation. We are going to take a break now here for lunch at our end. You'll be having your Ovaltine or bedtime, you know, whatever. And thank you so much for joining us.